Welcome to a special edition of Cleveland Health. I'm Richard Stewart. I'm standing on the front porch of one of thousands of Cleveland homes built before 1978, containing lead paint. Today, we're taking you inside the city's lead poisoning crisis. You'll hear from the public health director, meet a community member who lived through it, and learn about new programs helping displaced families. Plus, warning signs that lead poisoning may be affecting your pets. Cleveland Health starts right now. This is Cleveland Health, the show that tackles health issues that matter most to our neighborhoods. Each week, we bring you powerful stories, expert insights, and real resources to help you and your family live healthier, stronger lives. Join us as we dive into what's shaping the health of Cleveland today so we can all try to make a difference together. We begin with how this major public health crisis is impacting our most vulnerable residents, our children. Joining me now is Dr. David Margolius, Cleveland's public health director. Dr. Margolius, last October, the city released some alarming data which show we're dealing with a persistent health crisis. And while we have made progress, for example, childhood lead exposure rates did drop significantly from 2005 to 2019, falling from over 50% to around 18%, we've hit a troubling plateau. Since 2019, the percentage of kids with elevated blood lead levels has remained stubbornly stable at 18%. That's nearly 1 in 5 children tested. What makes this particularly alarming?
Yeah, so in Cleveland, we are covered in layers and layers of lead paint. And so it's hard to get rid of that exposure here in the city. That lead paint causes irreversible neurotoxicity, damage to the brain that causes learning disabilities and lifelong effects.
You know, the CDC changed their standards back in 2021. How does that impact the problem here?
Yeah, so we've long known that any level of lead in the bloodstream is dangerous. The challenge is that for decades, the lead industry was really trying to convince folks that a little bit of lead in the blood is okay. And so over the years, that level of acceptable lead in the blood has dropped to now it being 3.5 micrograms per deciliter, which is just about the earliest level that we can detect it.
Circling back to data, your own data reveals some troubling geographic patterns within the city of Cleveland. Can you walk us through the disparity between East and West Side neighborhoods and why the 50% drop in testing rates on the East Side between 2019 and 2023 is so concerning, given the elevated lead levels you're seeing in the neighborhoods like Glenville and St. Clair and Clark Fulton, for example?
Yeah, and so, it used to be really just the east side of Cleveland. Now it is Clark Fulton, it is the Cadell neighborhood that we're really worried about. And our data shows that there are way fewer babies, period, and fewer kids, period, on the east side of Cleveland. And so it is widespread. It is basically the problem exists where old houses exist and where kids live.
What else is driving those disparities from east to west side and in different parts of the city?
The biggest disparity is which families have historically and presently been able to access money to repair homes. And so if our families are living in homes that are falling into disrepair, haven't been kept up to date by the landlords or by whoever owns the home, compared to other families that have access to more money to be able to put into their homes and get the lead out or keep the lead safe, that's what we're seeing in terms of that disparity.
You know, the testing numbers themselves tend to alarm parents in particular. Can you walk us through what's happening?
Yeah, and I will tell you, the number one thing that I worry about is testing those homes. Because my ideal world is that before a baby comes into the world, the home is tested, the home is made lead safe or lead free. And then, that baby gets to grow up in an environment where they never have to worry about getting tested for lead because there's no lead there. But in the meantime, we're still, focused on testing children as well so that we can catch lead poisoning early enough to be able to do something about it.
Let's turn to intervention. Once a child does test positive, what does that look like?
Yeah, so our team here at the Cleveland Department of Public Health, we get every result of lead tests that happen in the city of Cleveland from the state. And we follow up with those families to find out what's going in their home. We'll go then and visit, do an inspection if their level is high enough. And if we find the source of lead poisoning, then we give orders to the owner of the home to fix that lead hazard.
What finally needs to be done to break this plateau? What's your 30,000-foot view of what a solution might look like here?
Yeah, so the reason Cleveland has more lead poisoning than, say, a city like Phoenix or cities in Florida is because we have a lot of older homes. And so we need to build new homes that are affordable. We need to fix old homes that can be fixed, we need to fund that. And then we need to demolish old homes that can't be fixed or saved. And so that way, over time, our children are more likely to grow up in an environment where they won't be exposed to lead.
Any final thoughts for so many parents out there throughout our city who have been concerned about this issue for a long time? What do you say to them?
I think the number one thing for parents is to get their homes tested, to know what lead paint looks like and to identify that and to help get that cleaned up so that their children never have to be exposed to lead in the first place.
Well, Dr. Margolius, thank you so much for joining us and addressing such an important topic here in the city of Cleveland.
My pleasure. Thank you.
And we'll be right back after this message.
Today's vote, in my eyes, is not a very difficult one.
At Cleveland Rape Crisis Center, we believe that everyone deserves to feel safe, supported, and heard. For over 50 years, we have been here to help survivors of rape, sexual abuse, and human trafficking rebuild their lives and to prevent future violence through education and advocacy. Our services are confidential and always free of charge. We provide 24/7 crisis and support hotline for immediate help, individual and group counseling to promote healing, specialized services for children and families, advocacy and legal support to navigate complex systems, prevention education to empower communities, resources and support for deaf and hard of hearing survivors through our Deaf Pathways program, and drop-in center for the on-spot assistance. No matter what you're going through, you are not alone. Call our 24/7 hotline at 216-619-6192 or text 216-619-6192 or visit clevelandrapecrisis.org to chat with a trained professional. Help is here and healing is possible. Together, we can make a difference.
This is a special edition of Cleveland Health. I'm Richard Stewart. Every parent's greatest fear is seeing their child suffer. But for grandmother Benita Shaw, that fear became a devastating reality when her grandchild was diagnosed with lead poisoning. Benita, thank you for being here to share your story. Tell us about your grandchild prior to the diagnosis.
Prior to the diagnosis, we noticed that she was a little hyper. But nothing too out of the ordinary for a 2.5, 3-year-old child. Well, her mom took her to the doctor for regular physical, and doing the blood work, the lab work, they did lead testing. And that's when we found out that her lead was 16, which is very high. At that time, I think that it was a 5 was considered high. Now it's a 3.5 that's considered high. But during that time when it was diagnosed that she had lead poisoning, my concern was with her mom, this is going to be a permanent thing. Can we reverse it? What happens to her from this point on? It gave us some answers as to some of the different behaviors we were seeing in her. After the diagnosis, then the long drawn out treatment came. It was a lot for her mom.
I bet.
She also had a child that was diagnosed with sickle cell during the time. So, well, when he was born. So it was a lot for her.
So what did you as the grandmother do? You mentioned earlier that it takes a village. That's your belief system. What did you do as the grandmother to help your daughter with her daughter?
Well, we went to the doctors together so that I could learn more about what was going on, what to expect, what could we do to counteract this that was going to happen. I participated in her diet. If she was at my house, we stuck to the regimen. If she was having issues, different calm down techniques when she would become hyper, just different things that we could do at each house to continue the treatment going.
How did lead poisoning affect her daily life and her development as a young person?
As a young person, she was diagnosed with hyperactivity. There were learning disabilities. It was a lot. It was a lot.
So how's she doing today?
She's actually doing pretty good.
Tell us about that.
She's 19 now. She still has HDA medicine that she takes. There was a lot of tutoring from her aunts, myself. She's graduated high school, live in Illinois. She's now attending SIU Evansville, the classes for childcare. It's still a lot of tutoring there, but she's really accomplishing it, and I'm so proud of her. And she works part-time for one of the daycares back there.
That gives so much hope to parents whose children may have been diagnosed with lead poisoning, for you to say that. What's your advice to parents who may be dealing with this type of thing? And can you give them something to look forward to, a little bit of hope?
First things, we need to have our children tested. Blood draw, not just a finger stick. The blood draw is going to give you the more accurate count of what the level is in the child's blood. Secondly, when you find out that they do have this going on, stick to the routines. There's iron that they have to take. Make sure that they're taking it. Make sure that their diet has changed, more fruits, more vegetables, less sugar, less starch, things that are gonna counteract and get the lead levels out. It's not gonna be easy if the child is hyper, but find things that the child likes to do. She liked to sew. Who knew? She loved to cook. My mother was alive at the time. My mother taught her what they used to call in the South, hot water cornbread. She taught her how to make it, and today she still makes it beautiful like my mom. So she loves to cook. Those are things that we geared her towards when she would start getting a little overactive. It's like, okay, well, let's go for a walk, sweetheart. Oh, you want to come in and help me with dinner? We kept her busy, and it would help her calm down because those are things that she enjoyed doing. So we have to find things for our children to do, not just medicate them, but find things to burn that energy. Her aunts would take her for a walk, take her to the park. They would do what's called park hopping, where they go to one park, play, then they get back in the car, they go to another park. Burn that energy. And you have to just let them know you're okay. You're okay. It's fine. As she got older, well, it's my fault. It's not your fault. We have to reassure them, love on them, let them know you're not different. You're just a child. You're special in your own way anyway. So these are things that we have to do as a parent. And it's okay. You're going to get down. You're going to get discouraged. But know that everything that you're doing is helping that child have a better life as they get older. And I look at her now, and I look at the things that not just her mother, not just me, but my mother, my brother was still living, my brother helped, my other daughters helped. These are things, and it wasn't easy. but we had a village. And looking at her now, it was worth it. It was worth it. I did send some pictures of her as a baby and during the process. It was worth it. She's a beautiful young woman.
Such great advice for parents, Benita. Thank you so much for joining us today and sharing such an emotional story. And if you suspect lead exposure, contact your pediatrician or call Lead Safe Living at 216-263-LEAD. That's 216-263-LEAD. If you live in an older home, your children could be at risk for lead exposure right now. Joining us is Dr. Rupa Thakur from Cleveland Clinic's Children's to explain when to have your child tested and what to do should they test positive. Dr. Thakur, thank you so much for joining us. When should parents bring their children in for testing?
We're asking for parents to come in for testing at 12 months and 24 months. And the reason for that is because when kids are small, when their brains are actively growing, when they're playing on the floor and they're crawling and picking up all that lead dust on their hands, and then putting their hands in their mouth, we know that that's when they're most at risk for lead poisoning.
And what can parents expect when they show up at the Cleveland Clinic Children's to have their child tested?
Yeah, so all of our practices now offer filter paper testing, which means that we could do the lead test with a quick finger prick right here in our exam room. If you have other labs that are needed though, your provider will take a look at that, and we always want to minimize pokes for our kids. So if you need other labs, we'll do it from the lab downstairs.
How can parents prepare their child to come get the test? Some kids are apprehensive about any medical procedure, frankly.
So the lucky thing is that at 12 months, most kids are not, they don't need to be prepared, really. They come in, they do what we ask them to do. There is, though, for our older kiddos, a board book that the Ohio chapter of the American Academy of Pediatrics puts out that goes through why lead testing is important, what will happen at the doctor, and gives parents some useful information as well.
So what happens if a child tests positive?
So at that point, then, depending on how high the lead level is, it may prompt a public health response to come and look at the house and identify where the lead might be coming from. And it will also prompt the primary care provider to order repeat lead testing to make sure that that lead level comes down over time.
So are there any costs involved for families in this whole process?
So the lead test itself is considered part of the well child visit, so there is no out-of-pocket charge for that. Insurance will cover it. If there are downstream needs that a child with lead poisoning might have, such as therapies, physical therapy, occupational therapy, speech therapy, there may be costs associated with that depending on insurance coverage, but the lead test itself should be free.
And what's your overall advice? What message do you want to send to Cleveland parents about the dangers of your child testing positive for lead and how to avoid it?
Yeah, there are three things that I really want parents to know. One is that when kids are most at risk, they are usually asymptomatic. So they won't tell us that they're being lead poisoned when it's happening. That's why that screening at 12 and 24 months is so important. The second thing is that most of our homes are at risk for lead poisoning in this region, just based on the age of our housing and the industries that were here before. So even if you don't think it's a problem in the house you're living in, it still is a useful thing to get your child lead tested. And the third thing is that it's a simple test. And with just a prick, we can know for sure that your child is safe.
Do you have reason for optimism right now about where we are as a city in our fight with lead poisoning?
I think there's a lot of momentum right now. Our city is doing a lot. The Lead Safe Cleveland Coalition is doing a lot. The Ohio chapter of the American Academy of Pediatrics has their eye on this as well and is doing a lot of quality improvement work with our providers across the state. I think there's a lot of attention on it. And the more that we can encourage families to get their children tested and to get their homes addressed if there are lead hazards there, the better off we'll be.
Well, Dr. Thakur, thank you so much for joining us.
Thank you.
And lead poisoning just doesn't affect children, it can also harm your pet. We're going to bring in an expert to explain coming up next.
Hello, I'm Scott Osicki, Chief Executive Officer of the Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County. We know that life can be overwhelming, but you don't have to face it alone. If you or someone you know is feeling anxious, depressed, in a mental health crisis, have alcohol or other drug use concerns, or just need someone to talk to, help is available. Call or text 988, the Suicide and Crisis Lifeline. It's free, confidential, and available every day 24/7. Trained and caring counselors are there to listen, support, and help you find hope no matter what you're going through. Remember, you're not alone. Call or text 988 anytime because your mental health matters and so do you.
Hello, I'm Michelle Princeton, and I'm a licensed social worker working for the Social Support Service Unit out of the Mayor's Office of Prevention Intervention Opportunities for Youth and Young Adults. The City of Cleveland has demonstrated a long-term commitment to residents working to create safe spaces in our neighborhood resource and recreation centers where families can access free resources and support services. We are committed to working together with families and other community providers to identify and help families who are struggling to achieve a better quality of life. To access the social support services, leave a message at 216-664-2223 and a team member will return your call. Our work includes referring individuals to appropriate services such as medical, hospital-related, long-term counseling, public assistance, veterans benefits, Social Security, Medicare, Medicaid, food stamps, housing assistance, Head Start, and student loans. We also provide support and guidance for youth and young adults in addressing stigmatization, scapegoating, labeling, bullying, substance abuse, and unhealthy relationships. Once again, to access social support services, leave a message at 216-664-2223 and a team member will return your call. Thank you.
This is Cleveland Health. I'm Richard Stewart. We've talked about lead poisoning in children, but your pets could be at risk as well. Here to help us recognize the warning signs of lead poisoning in pets is Akbar Tyler. He's a healthy homes and lead testing expert here in the city of Cleveland. Akbar, I've got 3 pets myself. What should I be looking for in terms of warning signs of when they could be affected by lead poisoning?
So warning signs, it depends on the pet, right? So you think about cats, dogs, and birds. So tail bobbing, ataxia, tremors, seizures, those are kind of the effects, but the signs you'll see they're a total change in behavior.
What about their eating habits? Are there any signs to look out for in terms of what they're eating, what they're not eating, how they're reacting to their food?
So in cats in particular, you'll see signs of them chewing on non-food objects. They call it pica, right? They'll start chewing on just objects. You know, cats are always doing that anyway, but they'll start doing that even more.
What about dogs?
Dogs the same way. They'll chew on different things, inanimate objects, but they may lose weight. Appetites may change. They may get reclusive.
Are seizures a concern at all?
Seizures are a concern. Yeah, seizures are definitely a concern, especially in smaller dogs. Smaller dogs can't handle the amount of lead that the bigger dog can consume. And yes, seizures are a problem.
So what's your overall advice to pet owners? What should they really be laser focused on if they feel they could be at risk of their pet catching lead poisoning?
So we think about lead. There is lead in the soil. So animals that play in the soil, be mindful of that. Painted surfaces, like a windowsill, for example, could be painted with lead paint. Dogs tend to bite those windowsills, and they can actually expose children to lead at that time too. So yeah, things like that.
Akbar, thank you so much for joining us today and sharing these valuable tips. And if your pet is showing signs of lead poisoning, take them to the vet or call the Lead Safe Resource Center at 833-603-5323. This is Cleveland Health. The Let's Safe Cleveland Coalition has just launched a pilot program that addresses a critical gap. What happens to families who can't stay in their homes because of lead hazards? Joining us to explain this groundbreaking initiative are Wyanette Shears, Associate Director of Programs for the Ohio Market and Enterprise Community Partners. She is part of the team managing the Lead Safe Cleveland Coalition. Also joining us is Zach Kofer, Director of Programs at Environmental Health Watch. Wyanette, can you walk me through what the Lead Safe Coalition does and how that role fits into this work?
The Lead Safe Cleveland Coalition was established in 2019 to help address the city's lead poisoning crisis. We know that if children live in properties built before 1978, they're at risk of lead poisoning, and 1978 is when lead-based paint was banned. And so the coalition brings together a variety of community stakeholders to create a comprehensive approach to lead safety. And we also operate the Lead Safe Home Fund, which is comprised of administrators that provide grants and financial incentives to ensure that local property owners have the resources necessary to create lead safe units. The Lead Safe Home Fund also operates a number of programs, including the Lead Safe Resource Center, which we are here today, which is a one-stop shop for all things lead poisoning prevention. We also offer workforce development training, lead education, a lead safe childcare program, and lead screening and testing. And so we're really excited to partner with Environmental Health Watch to offer this relocation assistance program to support families that may need a safe place to live while either their property is being remediated of lead hazards or if they need more permanent relocation assistance due to other lead-related issues.
Zach, for these families, this is a crisis. What does displacement look like for these families?
Yeah, well, Richard, not every situation looks the same for each of the families. And so it's important our team built strong relationships with the families to learn about their situations. Some families will need just temporary support while their properties are being remediated of lead hazards. And there will be other situations where families might need alternative permanent housing that's lead safe because of something like a lead hazard control order that's outstanding and there's been a vacate order issued on the home.
What other types of assistance is available for these families?
Yeah, so we offer relocation assistance, whether that's temporary or permanent relocation. We will work with the families to learn about their situations to make the best call there. And then during enrollment, we will provide wraparound support for the families, which includes case management, housing and resource navigation, education, stipends, and vacuums and cleaning kits.
How do you differentiate between which families need permanent relocation and which need temporary relocation?
Yeah, so it all starts out, we make a strong effort to build strong relationships with the families so that we understand what their situation is. And then once we have a better understanding of the situation, then we can work with them to provide that temporary relocation assistance or the more long-term. Like I said, an example of temporary would be if there's lead abatement or remediation happening on the property, and an example of long-term or permanent relocation would be if there's an outstanding lead hazard control order and there's been a vacate order issued on the home. And so the family then has to leave the home and we'll help them find a new place to live.
So your goal is to serve 100 families. That's an ambitious goal. What does success look like?
Yeah, serving 100 families over the next 10 months is definitely an ambitious goal. But part of our implementation strategy is to build a strong referral network with existing partners and systems so that we can catch families before they become displaced. And then success also looks like preventing displacement for families that are impacted by lead issues or lead hazards. It also includes preventing financial hardship on families caused by displacement related to lead. And then it also includes, lastly, that we're trying to build a model that can be used and replicated for future Cleveland families. If there are any residents of Cleveland that are concerned about being displaced because of lead hazards, they can reach out to our hotline at 833-601-5323, ask for relocation assistance, and our team will facilitate that process to help them get connected to our team.
Well, thank you both for joining us. Extremely important information to share with our viewing public. And thank you for watching this special edition of Cleveland Health. We hope the information shared today helps keep you and your loved ones safe from lead exposure. I'm Richard Stewart. Take care.